Yes, you should Google your symptoms sometimes. If I can explain. Hi guys, my name is Ada and I'm a medical doctor living and practicing in Nigeria. So the age-long question, should you Google your symptoms? Let me give a scenario to make it clearer. You are in your bed in the middle of the night and you develop a headache. Should you Google your symptoms? No. So, in what situation should you Google your symptoms? Well, I'll start with this. Medicine has moved from paternalistic, where your doctor is all knowing, your doctor is always right, your doctor is all of that, to shared decision making, where you want the patient to be in the know as much as possible. So now there's a lot of emphasis on counseling, making them understand condition, what their options are, and a lot of other things. So when I say should you Google your symptoms and I say yes, I mean if you have a diagnosis, you should be interested in using Google to find out more about your diagnosis. Say the doctor says you have diabetes. I encourage people to read about diabetes. If you have diabetes, read about it. Be in the know so that you can come for your follow up visits. Yes, that's one of the reasons why you should be going for follow up. You can come for your follow up visits with your questions and your doctor can answer them. It's usually easier to have a conversation with a patient that already knows what you're talking about compared to somebody that is just getting that information the first time. Because the truth is, they might not be able to digest a lot of what you're saying in that clinic visit. So if they've read about their diagnosis and they come and you're counseling them, it's a better conversation. So Google is not totally the enemy of medicine. So it's not really Googling your symptoms, it's Googling your condition. I'm saying this because a lot of people are told things in the doctor's office and they have questions, but because they've not really digested the information, they are not able to ask those questions. And then when they go home, they will ask my colleagues that are not doctors, they are not health workers outside, and they will be giving them all sorts of myths and fables, and that's the one they will believe. So a patient that you spent your time counseling in the clinic comes back and says that they said they should stop their medicine because one thing happened. So I think Google is powerful for helping us, aiding doctors to explain things to their patients. But when you don't have any direction, when you're just having symptoms, Google tends to give you the worst the worst ever outcome possible. So you have headache and you tell you that you have a brain tumor. So yeah, I don't think that is healthy. So at that point, no, just leave Google and just come to the hospital. Google is not a doctor. Okay. Then there's also this other side to it, where people have symptoms, decide by themselves. They're not medical professionals. They decide by themselves that I have a brain tumor. So when they come and the doctor is trying to take history, they're like, Doctor, I have a brain tumor. Who told you you have a brain tumor? Dr. Google, based on my symptoms, I think this is what I have. So why did you come to the hospital? Why did you come here for a diagnosis? That one is not good. It's very frustrating when you're talking to a patient that thinks they know everything. So in your mind, you're wondering, so why are you here? Especially why when that thing they think they know is wrong because they don't have the training that you have to make a diagnosis. Which is why I think I'm digressing now. Which is why I think that AI cannot replace doctors anytime soon because you have to put two and two together. Patients are not textbooks, they don't come with textbook symptoms. So there's a lot of thinking that goes into what we do, which is why we spend a lot of years training to do it. Okay, so but that was a digression. So, moral lesson, should you Google your symptoms? No. Should you Google your diagnosis? Yes. Should you get more information about your diagnosis? Yes. That is the right thing to do. Thank you so much for watching. If you enjoyed this video, please leave a like, leave a comment to tell me what you think. Do you ever use Google for health things? Let me know in the comment section. If you're Googling your symptoms, still let me know in the comment section. So I'll tell you don't do that. Okay. Share this video with other people so that they can also learn. Thank you so much for watching, and I'll see you in the next video. Bye.